Well, just with what you've already discussed, normally I do an interview with a doctor such as yourself to bring in patients from your area, but what you're talking about is so cutting edge and so uh, um, new in its protocol. I would imagine people watching this would fly in from all over the country, maybe the world. The world has gotten small with social media.
Well,
Thyroid.
Sarasota is a beautiful place to visit. So
Yes, it is. It is. I love it there. The thyroid is a hormone that perplexes so many. And what I hear from, I mean, I'm not a doctor, but when I look at someone, I know what the signs are, especially on the face. I can tell by the way people are acting and their hot and cold issues, etc. And I always say, maybe you should ask your doctor about your thyroid. Oh, my thyroid's fine. But what I find is most doctors are still only testing for T4. What do you test for with the thyroid?
well, the only one that really matters, when we do a baseline screen, we're testing pretty much everything, but it's the free T3. That's the only number that really matters. The TSH, the T4, T3, free T4. The only one that really matters is your free T3, and that you have to optimize. The only patients that we occasionally see that are somewhat reluctant to address their thyroid, or they ask, well, can I just take a natural supplement first before you start, replacing that hormone? It's kind of funny. They don't feel bad about optimizing their estrogen and their progesterone and even their DHEA and, even their testosterone, men and women. But it's almost like they look at it as a sign of failure if their thyroid isn't, working properly. And I tell them it's actually the first endocrine organ to fail. That's really how I got into this area of medicine. I mean, for years and years, I grew up in Tennessee and had Raynaud's. And so I thought the reason why my hands and feet were so cold all the time was because I had Raynaud's. Then I actually heard a lecture, read a book that made me read another book, and that was the first endocrine organ I started looking at, and went to somebody that did this and got my free T3 optimized up to around 4.5, and lo and behold, what I thought was Raynaud's was not Raynaud's. It was clinical hypothyroidism, and I barely, if ever, have any symptoms from that since. So that's the one and only target, that we have, is to get your free T3 somewhere around the 4 to 4.5 range.